So today, we are all gathered here because of one phone call that I got in February of 2016. So, have any of you ever received a phone call and on the other end of the line, a friend of you asked something that you thought was completely outrageous and just something you couldn't do? Has anybody had that happen to them? Well, it happened to me. Our next speaker was that person on the other end of the phone. He was the friend who made what I thought was an extreme ask. He called me on his way home from work. And he said, Terri, you should open a nonprofit. Now, he will tell you I'm not often speechless or quiet, but I was at that moment. And I told him, I said, well, I'll think about it. Well, that was then, and this is now. When someone asks you to do something monumental, you hope that they will stick around for you to lean on, right? That's the case in this instance. Dr. Chrysopoulo made the ask in February of 2016 and continues today to be the mentor in my life and why DiepCFoundation has been in existence since 2016. He's had my back in moments of doubt, guides me when I have questions about business and networking with other surgeons across the world. He answers my emails and messages and my texts. He not only has changed lives through his microsurgical skills, but he is an entrepreneur. He founded Toliman Health, and he will be speaking to us today about Toliman's flagship app, the Breast Advocate app, the world's first shared decision-making app for breast cancer treatment and breast reconstruction. He's an internationally recognized expert in breast cancer reconstruction and shared decision-making. He has been president of PRMA in San Antonio, Texas, since January of 2017, and has grown the practice to be one of the largest, more renowned, and successful breast reconstruction practices in the world. He has authored several book chapters and scientific articles in peer-reviewed journals. He's the founder of C&H Scientific, makers of Invisible Skincare, and a co-lead on the WHIS, that's World Health Innovation Summit, Shared Decision-Making Expert Group. I am taking this opportunity today for all of you to acknowledge the gentleman who I often call kind sir for a lot of reasons. Please help me welcome to the podium my mentor and the person who allows me to beat him at backgammon in the airport while we're waiting to go home from medical conferences, Dr. Minas Chrysopoulo.
Hello. Way too kind, Terri. Thank you so much. It's truly, it means a lot being here. Really, it means a ton. I've had the immense privilege of watching you build what you've built and what you continue to grow since 2016. And I couldn't be more proud of you. I really couldn't. So, you still have work to do, but Honestly, incredible. And it really warms my heart seeing you all here and knowing that there are folks online, so many of you watching. So really, really fantastic. If I had known this back then, I would have done things very differently. So I've heard this phrase from many, many women over the years, from all demographics, from across the US, from other countries. Where I'm really very, very lucky at PRMA. We are surrounded by a team that's very passionate, and we've managed to build a very successful practice, and we welcome people from all over, and they all say the same thing. Some of them are very upset. Some of them are very express immense regret that had they known certain things, they would have chosen differently, or they're upset they didn't have the choices. And this isn't just an anecdotal thing, right? It's 40% of breast cancer patients don't fulfill their preferred role in their breast cancer treatment. And when they try and fix it, what do? They go online. Of course, now social media, the internet's come a long way, KK. But unfortunately, for the information that's out there, it's often blurred with misinformation. And yeah, there are very few platforms that are as reputable as DeepC. And so patients are confused and they're overwhelmed. And so really, what I felt we needed was a clear, unbiased, and evidence-based platform. And that's how Breast Advocate was born. So historically, decisions have been made for patients, right? Not with them. And certainly when I came through training, I'd sit there in the rotation, I'd watch the consultant and he'd tell Mrs. Jones what he thought. He'd give her the diagnosis and he'd tell her what he thought, and she would say, yeah, yes, doctor. But that really doesn't take the patient into account in any way, shape, or form. An informative approach, it's a step in the right direction. It provides more information, risks, and so forth. But still, that's not a shared approach. So shared decision-making really, for me, is the most ethical approach that as physicians or any healthcare team member, we can use in treatment planning. So what does that mean? It means that you bring whatever you value to the conversation. So what's going on in your life? What are your preferences? What's going on at work? What do you need to get back to? What do you enjoy doing? Single, married, do you have a partner, kids, who's picking kids up from school? All these things that are going through your mind that are going to impact your decision. And then the physician brings their expertise. And typically, the best option is the intersection of all those things. So this truly is a two-way street. But as we've also heard today, diagnoses are very overwhelming, right? Extremely overwhelming. So a key point that I'd like you all to take away is that you get to define what you can bring. So defining the level of autonomy that you have in that decision-making process, that's up to you. So if you're overwhelmed and you just can't do it, and you know what, you want to just say, look, doc, I just can't do this right now. I can't. It's all I have to decide whether I'm having a lumpectomy or a mastectomy. I can't even consider recon right now. What do you think? That's okay, right? So shared decision-making doesn't mean you have to commit to 50%, right? So you can define that. Shared decision-making has significant benefits. It improves patient education. It decreases decisional conflict and anxiety. It builds trust. It helps you feel more confident in the treatment plan. It gives you an element of control when you have none. And it also improves follow through because you've got some real skin in the decision making, right? And even if you have a complication, the fact that you were part of the decision making helps you deal with it better with your team, with which you have built up more trust, because you know what? Everyone's the best doctor in the world when things go well. Critically, it also leads to improved outcomes, happier patients, and much less regret. Unfortunately, only 43% of women make what's considered a high quality decision when we look at breast reconstruction specifically, right? So my world. And what does that mean? What's high quality? Defined as knowledge of at least half the important stuff. You kidding me? Half is high quality? So, you know, we need to be doing much better, and we can get there. We get there with advocacy, better communication, tools, and support. And studies confirm the beneficial impact of shared decision-making, and not just on breast reconstruction, but there are studies across multiple medical and surgical specialties. So if this is so good, why don't all physicians practice it, right? I mean, it's not new. It's been around since the 80s. The Affordable Care Act was modeled on it. Shared decision-making is a core value, right? So why don't patients experience it? Well, because it takes time. And these days, you're lucky if you see your doc. You're lucky if you have more than 10 minutes. And, you know, who's got time to really deliver a shared decision-making approach? And I think that's the main reason why patients don't experience that. Again, that's why I really feel like tools like Breast Advocate can really be helpful. It's designed to give patients a tool that they need or they can use to take a more active role, to provide reliable and clear information at the right time in their treatment planning, or quite frankly, whenever they need it, as often as they need it. And it really, I feel I'm very proud of it because I really feel it's very valuable in empowering patients to have a voice in their treatment planning. So I'm just going to walk you through it very quickly. So this is the knowledge centers, what it looks like. It's a free download, by the way. You can play with it yourself. So rather than the typical textbook approach to delivering information, we've used this kind of choose your statement setup. And this actually came out of the advisory board, of which Terri was a massive part. Remember, we had so many patient advocates involved. It was great. It was a huge learning experience for me. I thought I kind of knew my stuff and I was doing well, but it turns out not so much. So we had advocates, who had chosen lumpectomies, oncoplastic surgery, mastectomy, aesthetic flap closure, prophylactic surgery, implants, all sorts of flaps. Men get breast cancer too. So everyone was represented, and it really was a very collaborative and collective effort. So you choose which statement applies to you, and it takes you down the path, right? And ton of information. We also have a library that's full of article abstracts. It's updated daily. You can save them so you can discuss them with your team. And we have other resources, a wide variety of assistance programs, financial, legal, insurance, travel, lodging. We have find a surgeon tools for each specialty or subspecialty, clinical trials. There's a ton of info. Very lucky to get some really incredible colleagues involved. Everyone I asked jumped at the chance. This is Dr. Jay Harness, incredible human being. He and I really connected. We share the same passion for shared decision making, and he was monumental. Yeah, there's 24/7 access to this free information. It goes through all the options, so you can be fully informed and you really have a more in-depth conversation with your team. We also have the wizards, and these are situation-based or question-based. Should I have a lumpectomy or a mastectomy? You know, that's probably one of the most common questions patients ask themselves. And this is based on an algorithm that uses evidence-based medicine, and it's been vetted by breast surgeons, and tremendously helpful. You can save the recommendation and again take it to your team. This is not designed to replace anyone on your team. This is designed to help you get the most out of your team. And remember, you're not alone. Okay, so we have a community here too. People chime in. It's great. It's really grown over the years. It's wonderful to see. So I really encourage you to once you download, kind of hop on. And lurking is okay. You don't have to post anything. Lurking is okay. Kind of test the water. So we've made a real impact. I feel very proud of the whole team behind it. Great feedback from patients. Great feedback from the members of the multidisciplinary team: navigators, general surgeon, breast surgeons, plastic surgeons. So really, we've done well. We've gotten a couple of awards, which is, yeah, it's always nice. So please check it out, breastadvocateapp.com. Download it, set up a profile, take a look around, join the community. I would maybe see you in the community. So anyway, that's Breast Advocate.